Thank you for the introduction, Peter, and thank you to the committee for inviting me to speak today. Some really interesting presentations so far, and I guess my presentation is almost at the other end of the scale in terms of down on the coalface. This is about how one screening centre in London has been dealing with the pandemic and some of the procedures and some of the interventions that we've put in place to address some of these barriers. I mean, some of the previous presentations have talked about these sort of barriers for colorectal cancer screening, and then along comes COVID, as if we didn't have enough to deal with. So I'll talk a little bit about a bit of a timeline on what that's been like for the screening centre, and then on an intervention that we produced a patient information video when the pandemic started, and some feedback on that. And then some interim findings that we've had from the pre and post COVID questionnaire, or pre and post procedure questionnaire, that we've been implementing over the last few months. So just to give you a bit of a timeline. So at the start of the year, January, we had usual care, and then obviously by March, things had changed completely with the pandemic. Both FIT interventions, colonoscopy and bowel scope were all suspended due to the pandemic. And colonoscopy resumed in May, and this was initially for those FIT positives that had been suspended, their procedures had been suspended due to the pandemic. And then FIT invitations resumed in July. And within this period, we had something in the region of over 20,000 FIT invitations that hadn't gone out. And it's quite, Bowel Cancer UK has recently put out some data that over 1 million FIT invitations did not go out due to the pandemic. And lastly, you can see here, by up to now, October, November, we have caught up with our invitations. And this seems all very smooth, but what you've got to recognize is the context that this was going on in. There was, we had rising hospital admissions due to COVID. Staff were redeployed to respond to that. And all sorts of behind the scenes work was going on. All sorts of policies and procedures had to be put in place. Standing operating procedures, work instructions, infection control, and there was conflicting guidance, both from regional and local infection control, and all of this had to be dealt with. And I have to mention the clinical program lead, Sarah Marshall, who rallied the team, and it really was a team response about how we were going to deal with this. And the thought at the time was, how do we deal with this? Should there, even at this time, in the pandemic going on, there was talk about a second wave. So what did we need to put in place to ensure that the service could stay open? And there was no doubt that was incredibly stressful for everybody. And as you can see, there was definitely behind closed doors, there was a fair bit of hair tugging going on. Okay, so this clearly, what we have here, this is data from the bowel cancer screening database. It's a national database, and you can see quite clearly here that April, May, and June, the invitations and those that were screened was down to 0. So there was no FIT invitations in April, May, and June. But as I say, the service did resume in May for those that had a FIT positive, and had their procedures suspended. Okay, we did an internal audit. So when we resumed, we had 81 FIT positives when the service was suspended. Immediately, about 5%, not that many, about 4, immediately declined an appointment due to COVID. But the majority went through to be screened. When the invitations resumed in July, we had 140 that declined an appointment straight away. 100 have since been screened, and we did we've been doing a running audit on those, and it's a positive thing that actually these are reducing, since those that originally declined, and that's something that we're continuing to observe. As I say, we have cleared the backlog of all invites now. And I imagine other screening centres are doing the same. A very difficult time. So one of the things that we put in place, and actually this came about because on a personal level, I'm a surveillance patient, and I had my surveillance appointment in April. And even though I work within the department, I'm not clinical, so I'm not in the procedure room very often, but I had to go through for my appointment. And, I don't mind admitting it was quite daunting. I mean, it was very like, beam me up, Scotty, very, very Star Trek, everybody in full PPE. And in discussion, we decided actually patients need to see this. And also it's about trying to reassure patients that actually we're doing all that we can to protect both staff and patients. So the video itself takes you through a patient's journey from being swabbed, the whole thing about using hand sanitizer, about having to wear a face mask, but also, being able to see the staff in full PPE and what that's like. And hopefully that would be reassuring to patients, and some of the information from the questionnaire that we put out, supports that. So feedback on the video, about 40% watched the video, and most watched in English. And it's quite interesting. I mean, the video is up on our website, and we've had about 800 hits on the video itself. So hopefully that's having a positive effect. 18 did not watch the video. They say they did not need to watch the video, and it could possibly be here. Some of them are surveillance patients, or people that have had a procedure before and thought they didn't need to. Some didn't have access to the internet, and 17 didn't receive the video link. This is quite interesting. Some of the previous presentations talked about written information, and actually, the link to the video went out on the invitation letter. It was also sent in a text reminder, and it was also on the top of the questionnaire for the pre-procedure. So it's quite interesting there about how, with written information, it's not always taken in, and we have to think about how we can address that. On a positive note, all those that watched the video either agreed or strongly agreed that the information was useful and easy to understand. Okay, so moving on to the questionnaire. I mean, I think when we were in the first lockdown, it was very much about what do we need to look at? What is going to be effective for patients in terms of reassuring them? And we wanted to look at their anxiety levels. And we broke that down into 3 different categories. So there was general anxiety, COVID anxiety, and bowel cancer anxiety. And also we wanted feedback on the video, but also the measures that were put in place. And was there something in particular that was effective in reassuring people about coming and accessing the NHS? Public Health England have put out a national campaign within England. So it's about how we could tap into that and make use of it. In terms of our response rates, I mean, fairly small at the moment. We are still continuing, and it'll be interesting to see what as we go through the second lockdown, how that will affect it. 146 people, so 92 the pre-procedure questionnaire, 54 the post, and 37 did both parts of the questionnaire. In terms of the demographics and gender, 84 men and 62 women. That is quite reflective of our screening uptake rate. We've just completed an audit of the last 3 years screening uptake. And, even though the national data says that generally more women get screened than men, in terms of our locality, it's slightly more men. The mean age was 66. Just over 54% spoke English as their first language, and half, or 47%, identified as white British. And the other half identified from several ethnic groups, but the largest, which was Indian. In terms of our locality, again, that's reflective of our screening uptake. Okay, so in terms of general anxiety, pre and post, we had a sample of 37, relatively small. It'll be interesting to see what happens as we carry on through this lockdown. But on the whole, general anxiety was relatively low and actually reduced post-colonoscopy. And I think what we're seeing here is that people, and it's already been discussed, actually, pain is quite, or fear of pain, anxiety about pain of the procedure is quite high. And here we're seeing that people have had the colonoscopy, perhaps it's not as painful as they thought it was going to be, so that anxiety reduces. COVID anxiety, again, relatively low, both pre and post colonoscopy. And, again, we have to, recognize that actually these are people that actually came. There will be people where their anxiety is either to the fact that they're maybe not completing their fit kits or not coming for colonoscopy at all. But those that did come, their COVID anxiety was relatively low. And some of the other responses that I'll move on to hopefully will demonstrate that actually some of the measures that we've put in place are reducing anxiety. Pre and post colonoscopy, bowel cancer worry. And what you can see here, again, relatively low, but it does increase after the procedure. And what we're seeing here is probably that people that have had the procedure, that, people do the post procedure questionnaire just after they've had their procedure, certainly those that haven't had sedation. And a certain amount of those people, a certain percentage of those people will have had pathology. They'll have had adenomas and polyps removed, and they have to wait. So the histology is turned around within 7 days. So, people, it's quite understandable that their anxiety will be lifting until they get those histology results. Okay, so in terms of the questionnaire itself, so feedback on the measures put in place to minimize COVID. The swab was inconvenient. Predominantly, people disagree or strongly disagree. And it's quite interesting, actually, not all screening centres are swabbing, but as we can see here, they didn't find it inconvenient. And again, so people that have had the procedure, they will have had a negative COVID swab. Otherwise, they wouldn't have had the procedure, or they'd have had to wait. So obviously, that's reduced their anxiety around COVID. Again, we wanted to think about if there's another lockdown, what are people's preferences about where they have the swab test? And as you can see, people disagree with about having it at home or at the local testing station. So, this is something that we wanted to know so that we could make sure that we were reducing those barriers around being swabbed. As we predicted, this is quite normal. I mean, very high. Having to use hand sanitizer on entry to the hospital was reassuring. Having your temperature taken, I mean, this was one of the strongest responses that we had. That actually, the majority were very high, 96% agreed that having, having temperature taken was reassuring. So again, reinforcing that actually these measures are, reducing anxiety about entering the hospital. Public Health England has had a national campaign about people, making sure that people access the NHS during the pandemic. And this is sort of informing us that these sort of measures are having an effect. Being asked to wear a face mask, again, very positive. And overall, the measures taken to reduce the risk of COVID before my appointment made it easier for me to attend. And again, this is very high, sort of over 95%. The staff being in full protective clothing in the procedure room was reassuring. And again, very positive. And so feedback, lockdown measures, I was anxious having to wait for my procedure. And, these are not so polarized. And you can see here that, 44%, almost 45% disagreed about having to wait for their procedure. I was worrying about the outcome of a bowel test would be. And again, you can see strongly agree with that. And that sort of links back to that bowel cancer worry, that sort of COVID anxiety is less, but there's still a great amount of worry about the outcome of the test. I was anxious about getting coronavirus. Again, strongly disagree. I mean, again, these are people that have come to the hospital, so they've seen all the procedures put in place, so their anxiety is going to be less. And the risk of catching COVID outweighed the benefits of having the bold test. And again, disagree or strongly disagree. And lastly, given the measures put in place, would I have felt comfortable having the bowel test during lockdown? And this is quite strong. 62.5% were reassured by the measures put in place. So interim findings, COVID anxiety, positive feedback on the COVID measures put in place. And it would seem that actually the procedures put in place do, reduce anxiety around COVID. General anxiety decreased after the test. And as I've said, people were no longer worried about the procedure itself and pain of the procedure. Bowel cancer anxiety increased. And as I've said, I think this is about people waiting for histology results. And I think if I have time, let me just check. Yep, well, no, not quite. I do have a question later on. I think it was really interesting, some of the stuff Linda was saying, and I'll bring that up as a question. But as before I finish, I'd just like to thank, obviously, Christian, Rob, and Galia, who we collaborated on this and were, in terms of the construction of the questionnaire and the analysis of the data, but also to thank the screening practitioners and the assistant screening practitioners who actually administered the questionnaire. Thank you for listening.
Thank you so much, Andrew. It was really interesting and obviously very appropriate for the time that we are all living in. We have one question from Kong Omorang. Sorry if I mispronounced your name, but how many tested positive and is it necessary? I assume this is a question about testing positive for COVID.
For the swab. Okay, so in terms of bowel screening, we've had nobody test positive prior to their procedure. Surveillance they've had 2 or 3. So it is picking it up. But I think what I would say to that, I think is about the level of assurance that it gives people around their safety on coming to the procedure.
And one question, are you doing anything differently during the second lockdown from the first?
We're open. We're open, the service is open. I mean, the main thing that's different is all those procedures, that we managed to get in place while we were in the lockdown the first time round. And yeah, the main difference is, we're open. We're open for business.